address that question that was sent in beforehand. How can you tease apart cognitive decline due to depression? Good evening, folks. Welcome. We will start at exactly 8:32. We're just giving some folks a few extra moments to sign in, and we'll be underway. Okay, good evening, everyone. Welcome to our discussion this evening on aging. What is considered normal or typical aging? When should we become concerned when we begin to see changes taking place with a loved one, someone we care about? These are some of the questions that we're going to be addressing this evening. With us tonight are two of my colleagues at OHEL, Harriet Blank and Esty Moradi. Harriet is the director of our geriatric services at OHEL. She has worked the complete continuum of healthcare and geriatric services, including the Brookdale Center on Aging. Harriet has presented at national conferences, and she's focused on developing a collaborative network of mental health professionals to provide excellent mental health services to older adults and family caregivers. Esty is a graduate of NYU School of Social Work. She has over 2 decades of experience working with adult mental health and aging issues. Currently, she is a program manager at OHEL's older adult programs, and in this role, she manages several mental health clinics sponsored by the Department for the Aging Geriatric Mental Health Initiative. Just one item of housekeeping. We always say that at webinars. The chat function on this webinar has been disabled, but the Q&A function is very much active. So any questions that you might have as we are speaking this evening, you can enter into the Q&A function. Those questions will be visible to the panelists and not to the audience. And we will get to as many of the questions that are submitted as possible. We look forward to having a great evening and a great discussion. So, Harriet, Esty, tell us, why is it important to know about normal aging? It seems like it's just kind of something we go through, and why does it even require a discussion?
So I think I'd like to start. Everyone, you can hear, it sounds loud enough, I hope.
Yes.
So why do we, and when this came up, what should we talk right away for what's wrong with people? What is the problems? I said, first we have to talk about what's right. And the reason I think it's important to focus on what's normal is that we tend to want to pathologize everything, give everything a label, make something wrong, make something that, what's a problem? What's the problem? But how can we approach aging again, as a normal function of life? There are things that we can expect, changes that will happen to most people that really don't necessarily impact on their life in a negative fashion. Again, some of it might have an impact based on psychological reasons, which is why it's so important to have this kind of a talk and kind of an understanding. But again, we need to know what is real, what's to be expected, and what's something to also not be afraid of. Because often what we fear is not true. And we're sure that something like this happens. Like, I'm going to say this because I watch television, so that on the show This Is Us, they have one of the main characters having Alzheimer's disease. And I promise you that the Alzheimer's Association is probably getting flooded with calls with people fearful that if this main character is having this, do I have this? What's with me? And I think that's out of fear, not necessarily out of reality. So we need to know what's good before bad.
Harriet, I was leaving shul last night with a friend of mine, my age, and he couldn't remember where he parked his car. And he's making jokes about, maybe I'm experiencing, early onset Alzheimer's or whatnot. Now, he's a busy person, always running around and whatnot. But I think that kind of dovetails a little bit into what you're talking about with the show This Is Us. People do forget things. It doesn't mean that you are losing the ability to function and live your life.
And if you have part 2 of us, we'll talk even more detail about what does it mean when you say you forgot your keys, and how can you as a person know the difference. We'll get to it a little bit later. How can you know the difference between I'm a busy person, as you said, Yitz, or is this something I need to worry about? Because again, knowledge is king.
So talk to us about what normal aging looks like, and what should a person expect, sort of in a more detailed manner. So normal aging.
So normal aging. So one of the things we thought about doing tonight, Esty and I, is to have a little bit of a quiz, an aging quiz, so that we start to learn what is some of the things that one can expect. So we gave you a list of questions, and this might be a good time to start. I think, though, that remember, whatever we say, I had one of my colleagues said, remember, when you've seen one person, you've seen one person. And I think that that's such a true statement in the kind of work that we do, whether it be someone who's older, someone with mental illness, someone who has an illness, someone who's developmentally disabled. I think that the most important thing to remember is that whatever we're going to be talking about today is general and specific at the same time. That's the balance. How is it general and specific? But to remember that don't go home, everybody, and say, Harriet and Esty said, so it must be so. Because this is a range. So.
Got it. All right. So research shows that old age truly begins at 65. Is that accurate?
So, the answer that we're going to say, since we see that we have people all over who are older, whether you like the politicians, whether you like CEOs, the answer is no. When you say that someone is 65, that's all you're saying, is that they're 65 years old. But we know today that old age can span literally from 65, which is, by the way, what the word senile means, 65, to 120. So think about what a person looks like between 65 to 120. And one of the things that I think is really important, or something that when we've done these talks, Esty and I, is I tell people that nowadays we divided old age, that's using older adults, into 3 sections. There's young old, 65 to 74. Usually those are people who are working, who are active, who are really nothing wrong. They're the same as they were when they were 55. That's young old. And people get very happy to hear that. Middle-aged or middle old is the 75 to 84. And those are people that tend to start retiring. Maybe they're slowing down. They're doing other kinds of travels. They're maybe babysitting for grandchildren, mentoring, just different kinds of activities. And some things start to happen, which we're going to talk about more in our quiz. And 85 plus, those are the old. That's the people that are in our minds of what is a really old person. But again, that changes too, because that's also what we should know is the fastest growing segment of this population in the United States. More people turn 85 plus in the US than are being born any single day. And as a little political statement, what that means is we need to think about older adults and how that's going to impact on workforce, on healthcare, on economy, on politics, you name it. But that is the fastest growing. And we should understand that being older doesn't mean that you have a range of issues, because for every person you're going to tell me who's old and sick, I'm going to tell you, remember that, how many times do you say, boy, that person acts like an old person? And yet for how many times do you say, at 80, she's so spry. I spoke to someone today who called for something in the office, and she said, how old do you think I am? She told me she was 92. And I said to her, it was the truth. You have the voice of a 65-year-old. So again.
And at the same time, there are people who are in their 40s who act as if they're in their 80s.
Mm-hmm.
And you say, oh, he's always been an old man. So
correct.
Absolutely, it's absolutely true. Let's talk a little bit about what is not normal about aging. Can we touch on that a bit? We've covered some of the normal, but then
Well,
there's
we're gonna stick more normal today. I'm gonna tell you what are some of the normal things that we can talk about when you're older, and things that you can expect. We talked about senses, so that was one. How are we going to do a poll? I just don't remember what.
Absolutely, we could do a poll.
So we'd like to ask people, if you can, I don't know if it's in an order or whatever, but what's normal about aging is that, of course, we wanted to do the true or false. So let's go through some of the questions. As people grow older, Esty will answer this one. As people grow older, their intelligence declines significantly. True or false?
Oh, it's false, because a lot of people have this misconception that, as they get older, their memory declines completely. They're gonna, get Alzheimer's, and they're gonna forget a lot. And that usually, that's not a typical thing that happens. Not the majority of older adults do not experience that. There are some that do. And so because we see people as they get older and they're living longer, the chances of them having those conditions are greater. So that's why that misconception exists. But it's we have a lot of smart older adults out there that contribute a lot to society. I think has a lot to do with the fact that people think that as you get older, you act older, and age is really just a number. It's really, it's really about how you perceive it, what your ideas about it are. And we have people out there who are what you would consider an older adult, that are very active and engaging and intelligent, and it comes through no matter how old they are.
And when we were talking about this, I told you this earlier, that last Shabbos I was at a shiur and with Rav Rimon, and he was talking about Rav Steinman, and he was saying that at 102 he needed some kind of medical procedure. He did very well, and the doctor said to him, "Thank God you survived it. You're 102." And he said, "And thank God you're still alive." And he said to the doctor, "Thank God you're alive," because no matter how, being alive, being well is a blessing at any age. We know people who get sick and die who are young, and we know people who get sick and die when they're older. Like Esty said, it's an age is a number. Do more things happen when you're older? Yes, and that is normal when you're older, that you're more likely, and again, it increases exponentially when you become older. But you can literally live till 100 and basically not have really any major illnesses. It doesn't have to happen. So I think that when we talk about what's normal, those are some of the things that we should talk about. But the other thing to talk about are what is normal. And again, how it impacts on your life depends on where these changes occur. Is what is normal is wrinkles are normal. It's normal to get wrinkles when you get older. Now, we might not like it. We live in an ageist society and we want to look young, but it's about lack of moisture and the things we did when we were young or when we were out in the sun. But, it's not pathological to get wrinkles. You might be upset, you might be vain, but again, it's not pathological. So wrinkles is a normal part of getting older. So is graying of your hair. Again, we might do something about it because we don't like the way we look, or we don't like the way it makes us feel. But then you have good therapists like us to help you with that, or cosmetologists or hairdressers. But the point is that it's a normal part of aging. And it actually starts in your 20s. So for many people. So again, you don't think that someone who's dyeing their hair because it's getting gray at 27 is an old person. But if you would see that same person with gray hair at 87, you'd say, what are they dyeing it for? They're just an old person.
But Harriet, there are people, let's say in their 20s or their 30s, who might look at that gray hair, and it's good you're pointing this out, and say, well, why am I graying so early? This is premature. Is there something else going on? So I think it's rather reassuring to hear that, it could start as early as then, and it's okay.
Mm-hmm.
And it's okay. Okay, go ahead. I didn't mean to cut you off. You were
and other parts that are normal about aging is when we talk about the senses, the 5 senses: hearing, seeing. How many times do people need reading glasses as they get older? The eye doctor I see said I had 20/20 vision until I was 65. And then he needed reading glasses. But this is a normal part. It happens. We can make adjustments. But again, hearing is another part. How many people, and why hearing is a very important thing for people to know. Hearing is a normal part of aging. There are people, but that doesn't mean, by the way, normal doesn't mean you have to have hearing loss. It means you can. It's not pathological. It's just a part of aging. But where it's problematic is sometimes when people can't hear, we often think they're confused, they have memory loss, they have a dementia, they have all sorts of other problems, when it's really that they can't hear. And again, we are a pretty vain society where people will not admit that they don't hear, and they'll just tune you out, which also can, by the way, also cause depression. Because if you can't hear, you could be at a senior center, you could be at work, you could be watching television. If you have difficulty seeing and hearing, you're not interacting with people, and social isolation might be a problem. But we who now survived 2.5 years of COVID know that social isolation was a problem for many people, young and old.
You know, there was a running joke in my family when my father was alive that regardless of where he was in the house, if you whispered the word ice cream, somehow he heard that.
Yes. Well, selective hearing is a whole nother issue. But
is that pathological?
no, that's coping skills.
Oh,
He didn't want to listen to you. He only wanted to hear you when you brought him ice cream. The rest of the time, he said, forget it.
Right.
But really hearing really gets misdiagnosed and misunderstood. So I'm harping on hearing because it is so important. But other things that we might not think about as much, sense of smell and sense of taste and sense of touch. Now, for most people, it might not be such a difficult thing. But if you're a foodie, or if you are a carpenter, or you like to do handiwork, having problems, little problems, like for me, I wouldn't notice it. It maybe if I couldn't touch as well as, like I wasn't feeling as well as I used to. I mean, feeling with my hands and being able to differentiate different kinds of textures. But if you're an artist, it could be devastating. So it's normal for most people. It impacts on your life base. And that's, to me, the important thing. Changes are important if it impacts on your life. And that is not just about aging, that's about life.
So now you're sort of crossing, so I'm sorry, now you're kind of crossing into what might become the more, what we say, pathological issues, or the issues where you might start to get, I don't want to say concerned, but pay closer attention to the changes. Is that correct?
You might want to, but again, you might also want to think of those changes, quite honestly, is how can you moderate them? Again, if your vision isn't as good as it used to be, you can wear glasses. You can use a hearing aid. You can figure out different cues for smells to see what's spicier or what's sharper. Maybe you need different kinds of things. And where might this impact? I'm going to tell you where it might impact. Your loved one, let's say, does have a problem, and you have a home health aide in their house. And what do they complain about? Everything that the person cooks tastes flat, tastes tinny. It doesn't taste right. They don't spice things. And you're saying, I'm telling you, Ma, the home health aide is cooking just like you tell her to. No, it's tinny. It doesn't taste right. That is actually a normal part as you lose taste buds and your ability to smell and taste. Now, will you die if you don't taste well? Unless you eat poison, probably not. Will it impact on the quality of your life? Maybe. And that's again where family, mental health therapists, socialization activities, ways to learn how to handle these what could be subtle or not so subtle changes are really important. But I want to say that they're not something that you would be running to the doctor, running to someone to say, I think my family member is in having a severe illness. They need severe intervention because they don't taste the food that I made the way they used to.
Yeah, anecdotally, as you were talking about taste and foods becoming sort of tinny in taste, I started to think a little bit about folks over the last 2 years who lost their sense of smell and taste.
Right.
And that's across the board, young people, older people, et cetera, and how it seemed, at least from the people that I've interacted with, they just kind of coped. Yeah, this is what it is, and hopefully it'll come back, which I think is probably the first time ever where we've had, a younger cohort experience such. And it's just interesting to think about how that might play itself out as that younger cohort ages. Oh, I've experienced this before. It'll be one less thing for the geriatric social worker to worry about, perhaps. Esty, looks like
another thing that, as you're talking about COVID, another thing that was really common during COVID, obviously, was social isolation, which up until then, younger people didn't really experience as much as older homebound seniors may have experienced. And I think that that's also something that we all shared, at least during that time, and were able to experience a touch of that and what that was like.
Someone
Yes.
actually just wrote in, they wanted to know if there's a link between the loss of smell and Alzheimer's.
I think that they're trying to see if there's some research on this. There's always coming up with theories. So at this point, how I'm not a doctor, I'm not a researcher, but what I do say is that until I hear for sure, I just kind of go with the behaviors and how can we best help these behaviors. I'll remember many years ago, probably before Esty was born, and I was doing a presentation and my window shattered and I went to get it fixed. And I told the guy in the glass store where I was going. He said, remember the aluminum pots. Don't let people eat with aluminum pots. It will cause dementia. And that was a theory way back when. They debunked it and now they bring it back a little bit. So that's why I'm saying, look at the behaviors, look at what we can do. And I think that part of the reasons back to why the original question, why do we need to know what's normal, is so that we can debunk some of the myths, so that we can deal with what are some of the problems, so that we'll know how to know what's a problem, what isn't a problem, because again, sometimes we make things bigger than they need to be. We need to understand why and how, but also to help an older person understand why. How many times do you ask an older person, is this, they don't even think it's a problem because they just assume, I'm old.
Right.
What should you expect? Of course, I can't fill in the blanks.
Right.
And we want to say, but that's not true. And, we use that where we talk about other kinds of issues with older adults. So any other things asked? Should we continue or go to another question? We have a few questions that we gave to Yitz in advance, the people in the audience.
That's true. And I also, though, I would like to get to the poll. We put together a poll, which really would give the audience an opportunity to weigh in and kind of give their thoughts and see what their level of knowledge is in this area. And I think that might also help guide the discussion. So if it's okay with you, I'd like to do that now, and then we'll see where it takes us. So I'm going to launch the poll now. This is to everyone in the audience. Here we go. You should see on your screen the aging poll. First question, the majority of old people past the age of 65 years old have Alzheimer's disease. Multiple choice, true or false? You will not be graded. Feel free to answer as many as you want, or as few as you want. All right, so people are starting to respond. To the first question, the majority of old people past 65 have Alzheimer's. Most people are saying that that is false. This is an educated group, a sophisticated group.
But we all know about true and false when we use the word majority.
That's true.
Right.
That is true.
I think they've been to some of Harriet's seminars in the past.
Harriet's got groupies.
Yes,
Very
that's
good.
true.
Very good. You got to know how to pick your panelists. Clinical depression occurs more frequently in older than younger people. Most people, actually, it's almost kind of even, but it seems like most people are saying that that's not true. As people live longer, they face fewer acute conditions, more chronic health conditions. Most people say that that's true. The next question, retirement is often detrimental to health. People frequently seem to become ill or die soon after retirement. The group is pretty much even on that one. And the last question is, most old people are set in their ways and unable to change. And the group is pretty much even on that as well.
Okay. It's good for us to have things to talk about. I'm going to quickly do the Alzheimer's, and then we're going to let Esty do depression.
All right.
So nice of me. So you are correct that the majority of older people do not have Alzheimer's disease. And the reason we really want to go through that is because everyone is fearful of that. But you need to know that there is potential for a modest amount of memory loss, but that is really short-term memory. A lot of times it has to do with the fact that we know so much. We're so busy. We're so active. We've we're slowing down because there's just so much, like anything, there's just so much in here
Right.
that we need to kind of compartmentalize and change it. And we kind of have to figure out how to best retrieve it. And so you should know that the majority of people, for sure over 65, do not have it, do not get Alzheimer's disease, memory loss, or what we're going to call later on, we would talk about multi-infarct dementia, which is other kinds of dementias. But that's another talk, because that's an hour by itself. So that the reason I'm going to say it again, remember the majority of older people don't, is because if you're seeing memory loss, and if you're seeing cognitive changes that are impacting on a person's life, then you know that it's a problem. And what we're talking about tonight are things that are probably not a problem associated with aging. That's the normal aging. So some memory loss that you might have really isn't going to impact on your life. So that if you couldn't find your keys, like it's his friend, if he stopped for a minute and said, where did I last put my keys? Oh, yes, I remember last night when I came home, I had a lot of packages in my hand. So I just dropped it, wherever I could. And look, there it is on the floor, right by the table where my keys are. In other words, you stop and think, you'll be able to retrieve it, to think about what was happening and to remember.
Right.
The other thing to remember is that when it is likely to happen, again, as I said earlier, aging in a way has been divided into the young, middle, and old. So for people who are in their young old, it's less likely. Middle old, sometimes you might be starting again to get an illness that is causing some kinds of memory or cognitive impact. And again, just to tease people, there are many reasons why this happens. Where you're seeing more memory loss or more problems, but even there, and it varies depending on the research, is the 85 plus. And again, 85 plus, that fastest growing segment, the people who are more likely to need medical and social services and home care, the 85 plus. But even at 85 plus, it's usually, so the statistics range from anywhere from 50% to 25%. And that's a pretty large statistical.
The statistics that what?
That will get some form of dementia or real memory loss that will be impairing their life. Now, but 50%, wow, 85 plus. But remember, 50% can get and 50% doesn't. How we play with statistics is just that, how we play with statistics. But now more and more, the statistics are leaning toward closer to 25 to 30%. That's a very big change. It's also a very big spread.
What do we attribute that to? Do we know?
So a lot of it they think has to do with that people are doing things to improve their brain health. They're eating better, they're exercising, they're going to their doctors, they're doing things to keep themselves active. Now that if you have an illness, you can say, but wait a second, I did everything right and I still got dementia. That might be. So I'm not saying this is the cure-all and the be-all, right, but it is helping, whether it be, and there's also more medications. Now, this might slow down the progress. And often when people die of Alzheimer's disease, they don't die of Alzheimer's disease, they die of another medical issue that might happen. And again, that's why it's important to get to know a person diagnostically at an earlier age if they are experiencing it. But it's, again, I'm going to say it again, really the majority of people have mild memory loss that does not severely impact on daily function. And that should make everybody in the audience go, whee! But it should also mean that we should not pathologize every time an older person can't remember something, or they're afraid to tell you they can't find something, okay, the next thing you're going to tell me is I have dementia, maybe.
No, I find that to be the case really it's really all people in all age groups, because all anyone really wants is to be, we throw around the word normal, or typical, if you want to try to be more sensitive, but, a child who loses a parent at a young age doesn't want to be treated differently than his friend, than their friends. They want to be treated like everyone else. And a person who is suffering, from dementia doesn't want to be reminded every time that they don't get something right, that, oh, well, like you said, there's someone with a psychiatric condition doesn't want to be reminded either that people just want to feel normal,
Good.
and they don't
And
want to have their deficits pointed out. We want to build on strength.
so the strength is to remember that you might do certain things differently. You might be slower, but that doesn't mean you're not getting to the points. And
Right.
and the question now I really want to reach, because I'm also mindful of time, I saw that, is the idea of depression. I want people to kind of understand, we are mental health professionals. So I want us to spend a little bit of time about understanding depression. And Esty?
Okay, so the statement was that clinical depression occurs more frequently in older adults than younger people. And the answer to that is false. Depression is not a normal part of aging, but it is the most common mental health issue in older adults. So you happen to see it often in older adults, but it doesn't happen at a larger rate in older people than younger people.
So, Esty, wait, before you go on, somebody's
Sure.
asking, though, connected to this, can we talk to what the reasons are for confusion in an older adult, as opposed to the reason being dementia? Are there other factors at play?
Right. So this is actually a whole talk that Harriet and I give on the differences between dementia, depression, and delirium. But just to answer that, in the context of depression, many times a symptom of depression can be, loss of focus, not memory necessarily, but not the ability, the ability to focus is something that is lost when somebody has depression. And you often see that in dementia too sometimes, and it can be confusing. So the difference is basically this: when it's dementia, it's something that's, it's not reversible. You could take medications maybe that will slow it down, but once somebody is diagnosed with some type of dementia, whether it's Alzheimer's disease or whatever disease it may be, it's not going to be reversible. But with depression, it is. So with depression, with the right treatment, with a therapist, some medication if necessary, and not everybody needs medication, but sometimes it does call for that, then you can bounce back and be normal or typical again, whatever word you want to use.
So this is like what we say to people in the trauma work that we do. When you're speaking with someone who's grieving, a person who's grieving will often mimic or display symptoms that are similar to someone who's depressed. But if you treat a grieving person for depression, you're not going to solve the issue. You're not going to help them with and so what you're saying really is the same thing here. You have to really know what you're looking at.
Exactly. And I think that part of the problem is that because there is so much stigma with depression still, and especially with older adults, they rarely go for treatment. And so then often misdiagnosed or not diagnosed at all. And even sometimes the doctors that they see are, will say, oh, well, it's normal that you're feeling down or sad because you're going through this medical issue, or, you're feeling depressed because you just lost your spouse. So that's, it's normal. But there's a difference between grief, normal grief, and feeling sad when you lose someone. And when that grief doesn't go away and doesn't, get less and less as time goes on, and you're still feeling sad and you can't function, then you may need to consider that it's depression. But because people are not necessarily going to mental health professionals and getting those treatments, then that's why they're suffering. And it's not normal. It doesn't have to be that way.
And so as a little plug for us at OHEL and some of our colleagues, the fact that we are able to bring mental health to where the older adult is. Not all older adults are really ready to go to a mental health clinic. Maybe those young olds, but maybe the middle and the old, where they're not only they might be feeling depressed or sad, socially isolated. They're not able to go out. They're not able to do the things that they wanted to do. But the fact is that we bring mental health to where the person is. We see a great deal of success. I was just talking to a colleague who said that when they were treating people with older adults with clinical depression, in 3 months, they see a 70% decrease in symptoms with therapy, not necessarily medication, but counseling therapy, whether it be group, coupled with some behaviors, socialization, whether it be teaching them new things to do to decrease social isolation, but just the fact of dealing with the depression and not saying, Oh, what do you expect? It's normal to be feeling this way. It's never normal to be depressed. Whether you're young or old, it's never normal to be depressed. And there is help out there. And we shouldn't be afraid or think that it's okay to say they're just, we don't need to get them. They're just an old person. They're just a kid. They'll outgrow it. They'll live out. They'll die. It's never okay.
It's a very important point, that being older doesn't mean that your quality of life needs to suffer, is essentially what you're saying. And you can still live and enjoy, and there's help available for everyone, is the point you're making.
Right. And that people of all ages want to be, most people, like everything else, we're going to go back to that,
Right.
true or false. Most people still want to have connections. They still want to be with other people. That includes, we have one question, I don't know that we'll have time, but I'm going to throw it out, the idea that older adults still want to have sexual experiences. They want to experience intimacy. And I remember when I taught a class that it was young PA students, they were all very, no, they don't. And they're not worried about sexually transmitted diseases. They are, but they don't think about it. But what is it? It's that they still want to be involved with other people. They want to have friends. They want to have peers. They want to have meaningful relationships. Making meaning is important for people of all age. And we as younger people, and that includes whatever that means to you, can still learn from an older person. So the person who I told had a young voice, she said, you should talk to my son, he's a senior also, because if she's in her 90s, then her son's in his 70s. So
I'll never forget, I had an interaction with a woman. She was 96, and she was dancing at whatever, it was one of these, it was a Pesach program we were at. She was out there on the floor dancing, no cane, no assisted, no hearing aids, just, doing her thing. And we started to talk, and she said, I still come to this program and I really enjoy it. My son always says, Ma, come stay with us. I have a nice house down by the water. We have a boat and so on. And she says, no, that's not for me. That's for you kids. That's for you kids. And so I said to her, you forgive me for asking, but how old is your son? And she said, just what you said. She goes, oh, he's 76. So you're absolutely right. Absolutely right. Okay.
So again, we talked about depression. What was the other question?
The next question on the poll, yes.
Okay, so did we address as people live longer, the acute conditions and so on? I don't think we talked about that.
So
The group was almost evenly divided. Most people felt that it was true that as people live longer, they face fewer acute conditions and more chronic health conditions.
Esty?
So I don't know what people said, half and half. So
It's about half. More
yeah.
felt it was true.
Yeah. So yeah, as people get older, they don't have as many acute conditions, like strep or, infections and things like that, but they do have more chronic conditions, like heart disease and blood pressure, maybe, and diabetes and things like that may, increase as they get older.
And they're more likely to have one or two of these chronic conditions. Sometimes it goes is because often we just misdiagnose by saying we don't need to think about it because they're just old. And again, that is, by the way, a two-way street. It also happens with us, like where we think so, as well as the older adult. So I think what that means is we need to learn how to manage chronic health conditions. Because again, what did we talk about, even what's normal? If it's normal to have chronic health conditions, you can live with diabetes. When you look at commercials about diabetic medication, you tend to not see older people that they're advertising. They're younger people living with diabetes,
Right.
learning how to live.
Right.
So the same question, that same kind of response needs to be for an older adult. How are you going to learn to live? If you are used to cooking for a family and you only have yourself or maybe your spouse, so you don't maybe need to make a pound of pasta for one meal, maybe a quarter will do. But think about, how that impacts on eating and all kinds of things.
Right.
By the way, the other thing to talk about is economic realities, which is something that we didn't put in any of our questions, but something to think about as your economic ability to have money, to earn more money. If you don't have enough money, as you lose that kind of growth potential, or you don't have the money you had when you're younger and your economic situation changes, that does impact also on aging. You might not have money to buy the good fresh vegetables and food, the fish, the healthy foods. And so often people will go to either fast foods or my mentor used to call it the tea and toast syndrome. I have nobody to cook for, so I just buy, I go to Dunkin' Donuts and I get a muffin and a coffee. And if you eat a muffin and a coffee every day for, let's say, lunch or dinner, you could be heavy and malnourished, or you can't afford the healthier foods. So economics does also play into aging, especially once somebody's retired. And maybe, one of the other things is we didn't think people were going to live as long as they did. So retirement monies, which they thought would last till, let's say, you're 80, 85, and now people are living so much longer. That's, in a way, that's a whole nother, that's a political and an ethical discussion, is having people work longer just because they can no longer afford to retire, and how that impacts on workforce. So, but another point, that there's much to talk about with older adults. People don't realize this.
There's no doubt. So the next question that we had put out was, retirement is often detrimental to health. For example, people frequently seem to become ill or pass away soon after retirement. And again, most of the group this evening felt that is true. Can you speak to that?
Yeah, I'll say something. So actually, I think that actually is false, but I understand why people, said yes. And the reality is that many times, it does seem like people have health issues, or they, there's mortality related or correlated with retirement. But in fact, there really is no correlation per se between the two. It's just that maybe the older adult may have had health issues before, which may have prompted the retirement to begin with. Or maybe it's other stressors that are happening, the stress of retirement, for example, that can create health issues. Now, if somebody, has stress at work and is finally thrilled to be able to retire and has, a wonderful plan of what to do once they retire, then, they'll be healthy and well. But again, the chances are that people are working longer, first of all, and for, out of necessity, maybe the financial issues that Harriet was talking about is causing the need to work longer, and people are having some health issues as they get older, right? And so again, it's not that the retirement is causing the health issues or causing the death, but it's maybe there's some pre-existing condition that is already there, and then the person retires. And what this reminds me of, I worked a lot in doctors' offices with some of the grants that Harriet managed, and one of the things that I would raise with some patients at the doctor's offices that we were at is the idea of end-of-life care. Some of the patients that were in the practice were oncology patients. And this idea of, having hospice care or palliative care was a very controversial issue. I'm not going to get into that, but my point is that sometimes I would go, if the client or the patient would want, we would make a referral. And then I broached it with one doctor. He said, well, no, don't make a referral for my patient. They're going to die. And it so happened to be, he's like, yeah, it happened with this patient. You made the referral and they died like the day or two later. And it's not that they died because of the referral. They died because, unfortunately, by the time the referral was made, the illness was so far gone already at that point that it was kind of too late, too soon, too late, right? So that was it. It wasn't that the referral to the hospice care,
Too little, too late.
Yeah, it was just a little too late. And but again, trying to debunk some of the myths and misconceptions. That's what we're here.
Right.
And when we think about retirement, where we hear that it's detrimental, it's back to what we talked about earlier: social isolation, lack of a plan. If you have nothing to do all day, but sit down and just, unless you really want to watch television all day, because there might be people that is really what they look forward to. But if you're not doing something that feels good and meaningful for yourself, then yes, retirement can be detrimental. But what the studies have found is actually retirement can be very helpful for people, because for the first time in their lives, often, especially the generations that are now older, they had to work. They had to go to work earlier. They didn't have as many choices, even education, because economically they had to go to work and just do what you had to do. You have to take care of your family. So for when you're retired, you see this. There are classes, there are courses, that an older person can now have. They can learn. One of the things people think is that an older person isn't able to learn, and that's not true. An older person can learn new things. They might learn differently. And that's called adult learning theory. When you're younger, when you're in school, you're used to it. You take notes, you take a test, you take notes, you take a test. Once you start leaving school, you need to have much more experiential learning where you have to practice, you have to try, you have to see, like, how do you do this? It's not the same kind of learning skills because your mind, your brain is different. But also, we all know this, those of people in the audience who might be teachers, that there are different styles a person learns. So can an older person learn? Absolutely. We see that with the work we do, where we're now introducing technology, new skills to an older person, and they're managing and they're learning and they have something to say. And for some people, you see this for college classes. I mean, I could go on and on about the different kinds of skills that an older person is able to learn. Back to that person that I said was my mentor, her husband, when he retired, he owned a business. So he hated it, by the way. He owned a clothing business for men and he hated it all the time. He had no choice. It was a family business. When he retired, he started using, and he was clinically depressed when he retired. When he retired, though, after a little therapy and a little medication, he said, what does he want to do? And he started collecting and doing artwork and also making things that were like little witty ditties that people could, but he said, but I'm a salesperson also. And he went to different, we don't have this as much now, Hallmark stores and card stores and places, and he sold what he created. But so he did his artwork. For the first time, he could be creative in artwork, but he also tapped into his previous knowledge
Life experience.
and how to be a salesman. And he said, look at that. At age 75, I have a new business, but this is the business I always wanted.
Wow.
So I think that it reminds us that we can teach people. And we know this when we see older people using, cell phones and FaceTime and all those things. So we need to know this. WhatsApp, when we talk about that. And for the other thing I wanted to say, just because, again, it's how we view aging, is that when we see older people looking depressed and detrimental and it's hard, sometimes we think of people who are in a nursing home. People in a nursing home, which is few and far, there's really less than 10% of the population, 85 plus, in a nursing home. Those are people that might die sooner, mostly have Alzheimer's disease. But again, as Esty said, it's because of illness, it's because of lack of proper social connections. It's not because they're just old and they're in a nursing home, because, in case there are any questions, and I do want to be mindful of time. I don't know, you're the timekeeper.
I'm watching closely.
I want to make sure people understand that we know that it's a myth that families, even though families are different now, you're not seeing 3 generations living together like it was, back in the day. But families, the modern families, do take care of their older relatives. We do come into contact. We do think about their care, whether it be caregiving at a distance, whether it be visiting, whether it be FaceTimes, as we said earlier, whether it be helping to get help. Sometimes it's actually, and I know I've said this at different presentations, it's more coveted, it's more honorable to get help for a parent than to actually be the person who's giving the help. Again, that's a conversation worth having with your family member. Your family member might not actually want you to be doing the care. But again, that's something that I know we've talked about, that we need to think about those kinds of things, so that this should be a talk of hope, to understand that there are normal things, like I keep on repeating it really for the sake of understanding. There are
Right.
normal things that we should expect, things that we can learn. We should allow our children and our grandchildren, and now thank God there are many people with great grandchildren and friends, to understand that we have what to learn from older adults as older adults have what to learn from us. We need to normalize the slowing down that can occur,
Right.
not pathologize, not rush to give people granny canes just because.
So just dovetailing into the last question on the poll, in the time that we have left, it also connects, the last question connects to a question that came in on the chat, on the Q&A. And so the last question on the poll was, most old people are set in their ways and unable to change. And for that question, again, the group was almost 50-50 on the true and false. And connected to that, as Harriet, you were talking about ways to combat social isolation and to keep, your brain active and healthy. Someone is asking if we know of any colleges in the Brooklyn area that offer adult education classes. So if we could speak to that, against this backdrop, I think that would be helpful.
We'll do both.
Excellent.
Esty,
ahead.
you want to start and then I'll.
So the answer to that question is false. Older adults are able to change. And in fact, if you think about it, the longer they live, the more life experience they have. And the fact that they're still alive shows that they're resilient and are surviving, and they've been there, done that, and they're thriving and surviving. And the way that they do that is by adapting to different circumstances that come their way. So in fact, they're able to adapt quite well and to change as needed.
And a nasty old person was most likely a nasty young person, as well as the other way around. It's just certain things might feel more exaggerated. Yeah. But of course they can change. I mean, and that's an important lesson in the trauma work. It's also where we talk about resiliency, that, what allowed people to get through bad times. So yes, but we don't think that people can change. We think about people being set in their ways. And I think that
you're saying we as a society.
Yes, we as a society, not we as therapists. Yes, we as a society. Thank you for making that point very clear. And I think that why that's an important thing for us to debunk and for us to say is, no, it's not true, is because it doesn't help the older person. It doesn't help us to think that a person can't learn or change or grow, or and it also is a cop-out kind of an answer, because we'll just say, what could you expect? And it just doesn't allow us to get to where we can see where people can. Yes, things might be not exact. And also, if we're seeing people that are very rigid, we know this as therapists. So this is the we as therapists. When someone gets stuck in their rigidity, that might be a sign for us that there's something going on. Something's wrong. And we might need to investigate. Now, it could be medical. I do not want anyone to go away from this evening to think that we don't think that there are medical things that we should look at. And that's an important point. So that, of course, people should have annual checkups, but annual checkups include medical, which include a full battery of tests and baselines, but it also includes psychological. It includes baselines for anxiety, for depression, for social isolation, for caregiving, for hoarding, for drinking, for suicide. A question that's often asked, are old people more likely to commit suicide? And the question really is, at this point, they don't think so, though we do know that older men have a higher rate of suicide than women. And again, I feel like I'm repeating myself, like you're going to think I have the problem, but it has to do with the social isolation and the lack of connection and the lack of being felt like they're being heard or understood. Humans want some kind of connection. Again, for some people, they might just need one bestie, and that's good enough. For others, they might need a group. Again, that's what makes us all so individual, so important. And that's something to think about. Now, I just want to make sure I answer the question. There are classes in Brooklyn College, Kingsborough have classes for older adults. If you actually either Google it or go online and kind of do a search for adult educations. You can actually see some of the classes. Almost all colleges have some kind of education classes. Dorot, which is a social service agency in Manhattan, has what they call, they have classes that they give always, even pre-COVID, online and through phones. I mean, they call armchair traveling, where you can just do, again, find out what it is that you like. We've done things during COVID. I think we did it. Did we do the Sudoku, like with the Queen's Library? And we did classes with the Queen's Library over Zoom and on the phone, so that not only did we talk, but people interacted. OHEL has a class where we have for women a Bible portion class that we have a partial class on Monday and Wednesday. It's still by phone, so that again, there are ways to kind of keep you stimulated. Just, call. If you can't find it, call us. We'll help you figure it out.
Very good. In the 2 minutes that we have left, there was a question that had come in before this evening. Someone had asked the following question: how can you tease apart cognitive decline due to depression and cognitive decline due to dementia? If my loved one resists going to doctors and I can only push for seeing a primary care physician, is there any testing that can be done in that setting to tell the difference between these two very different medical issues?
So this is related to the topic that we talked about before, about how to know, how to know the difference between dementia and depression. And definitely there are things that you can have the primary care physician do. And if they're not doing it already, like Harriet said, there are questionnaires and tests that people do for all different kinds of conditions, including dementia and depression. And so what those tools are actually are the PHQ-9, which is the patient health questionnaire, which asks the patient a series of symptoms that are related to depression, and it's scored, and the higher you score, the more likelihood of depression there is. And there's also a memory, the mini mental status exam that is often used, or any other memory cognition test that sometimes doctors can use in the office. It's very easy to administer, just takes a few minutes. And I think that doctors are doing these more and more. Not every doctor is doing it, but you could definitely ask and discuss it with the doctor to have it done beforehand. And this will give you an idea of where your relative or older adult person is standing in terms of their mood or dementia.
And it's in a good way to end this possible evening, to say we should have more, to kind of explain that if the memory or if the cognitive change is impacting on their life, there might be a problem. The question of whether it's a depression, a dementia, or a delirium, it's very important to know the difference. Again, look to see if it's impacting on lives. Some things are irreversible, so they can't go away. Even with treatment, you might slow it down. Some things can. And how sad is it for someone to be suffering when they don't have to, because we didn't get the treatment that we could? And by the way, as a quick aside, that includes someone who has dementia can also have depression, can also have delirium. You can have delirium at 7 years old. If you have a high fever, you might be delirious. Again, you would never say to someone who's 5, 7, not treating your delirium because the fever is going to go away eventually. So understand, you need to know the differences. But for that question, if you're seeing it and they're being very resistant, because that does happen, it might have happened even earlier. It might be that the person's afraid. But and sometimes you need to help someone say, we want to know, just so we know if we can treat it, so we can make you feel better. Because an older person might be afraid of what you're going to hear. So that's something to remember. But that there are very significant differences between dementias, deliriums, and depressions, because it is a problem, not a problem of old age, but it is a problem that could happen along the lifespan. We just want to try, we see it, we think about it when we're older, we just want to try to deal with it whenever it occurs.
All very, very important. And if you find that your doctor, really, I'm gathering from what Harriet and Esty are talking about, if you find that your doctor is not giving you the respect, the time of day, the attention to that which concerns you.
Get rid of it.
There are other doctors that you can find, and of course, we are available at OHEL to answer questions and to try to provide some guidance. This is not a plug. I'm merely offering a resource if your normal resources don't provide you with the answers that you're looking for. I want to thank Harriet and Esty for joining us this evening for this important discussion. I want to thank all of you in attendance for joining us this evening. Someone actually just wrote in and they asked, is hoarding more seen in seniors, which I think we're going to need to wait and try to address at another time. Next week, on May 10th, we will be having another TheraZoom session on a different subject, and that'll be entitled Closing Out the Year Strong, Bringing Out the Best in Our Students and Our Teachers. And the guest speaker next week will be Dr. Leah Waters, and that talk will be moderated by our Dr. Carly Namdar. So that should be an exciting talk. And if you're on the email lists, you will see notifications and I'm sure advertising online and whatnot. And we look forward to bringing that to you next week. So thank you all for being with us this evening, and I wish you all a good night. Good night.